Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. George Smith Jr. Dr. George Smith Jr. has been an assistant professor at the Chicago State University for more than 5 years. He has worked in social services, public health, community involvement, and nonprofit management for more than 25 years. His current areas of research interest include the impact of spirituality and religious belief on health behaviors and outcomes, ethical concerns in studying the African American community, the psychosocial factors that influence infant mortality in the community, and the social cultural factors that influence health. Dr. Smith is fervent about expanding the number of underrepresented minorities in the health science professions and is supportive of young people pursuing those career choices. He has a strong enthusiasm for tackling racial disparities and inequalities in health. He's also the program planner of the Black Caucus of Health Workers in the American Public Health Association, APHA. Welcome to this interview, Dr. George Smith Jr. We are honored to have you with us today.
Good morning, and thank you for the opportunity to participate in the interview.
Dr. Smith, please tell us about your experience as the Black Caucus of Health Workers program planner in the American Public Health Association. What are some of the programs the caucus aims to achieve?
And thank you so much. So I've been fortunate to serve as the one of the program planners for the Black Caucus of Health Workers, which we affectionately call BCHW since 2015. And so we have a lot of things that we do. Of course, as a program planner, one of my responsibilities is to ensure that all of our scientific sessions are properly staffed, that we have moderators and we have our presenters. But one thing that we really have, which sort of is our key event, is our Dr. Hildreth A. Poindexter Awards Gala. Dr. Hildreth Poindexter is considered the father or the Black father of public health. And so we give out this award every year to highlight someone who has done great work within the field of public health. And so how do we do those things? So some of the things we do within the Black Caucus of Health Workers, and this is just a little list, but not exhaustive, we try to provide a structure and a forum for which healthcare professionals of African descent can exchange views, develop strategies, and implement programs designed to improve the health status of the community of people of African descent. We also try to increase the number of people of African descent in health professions in the United States through targeted programs of outreach, recruitment, professional development, and mentoring. Of course, we love to collaborate, coordinate, and consult with other groups of health professionals and non-health professionals who share our mission, BCHW's, and purposes. And then we also try to provide input and positively influence the American Public Health Association activities, their policies, and commitments to the health issues of people of African descent through the section and other activities of the association. So we are a part of the American Public Health Association, and we were formally organized in the fall of 1968.
Fantastic work. Now, what are some of the current projects you are involved with as an assistant professor at Chicago State University, and which one you are most excited about?
So that is kind of a difficult question, more so the latter part. Which one am I excited about? So I'm kind of excited about everything. But as you know, in academia, we have responsibilities of doing research. We have responsibilities of doing teaching and service. So I'm just going to talk about 3 projects that I'm working on. One, I'm working with collaborators in Chicago, in which we're trying to understand how young adults go about finding information about the human papillomavirus and the HPV vaccine. And we're trying to see how they can describe factors that influence their decision-making and learn about health messages that are available online or through social media that can be helpful or not helpful, and helping them understanding the disease as well as understanding the effect and the purpose of the vaccine. I'm also participating in something called the HBCU Alliance for Maternal, Child, and Family Health Equity. We call it HAT-MCH. It's a program of the Consortium of African American Public Health Programs. The goal of this is to build a more diverse, equity-focused maternal child health workforce at all levels, to develop competent MCH leaders, to increase the problem-solving research capacity of HBCUs and predominantly Black institutions, and to improve maternal child health outcomes in the communities in which they serve. And then I'm also working on a project that is focusing on advanced planning care for African American caregivers of relatives with dementia. So those are three projects that I'm working on. I find them all to be very fascinating.
Wonderful. I can hear your passion. What role do spirituality and religious belief play, according to you, in the formulation of health policies that affect the African American diaspora and its impact on public health?
And so, as we look at African Americans or Black individuals in the United States, religion has played a tremendous role in regards to that. Black churches have historically taken on numerous activities and roles within the African American community, from education to civil rights, fighting for voting rights, fighting for social equity and social justice. And so, because of that, it has a great influence. As although church attendance is down for all individuals, regardless of race and ethnicity, we do know that based upon my interactions and based upon looking at various reports, that the African American church plays a tremendous role in influencing African Americans. One other thing too, because of the Black religious experience in the Americas, we know that African Americans go to church to get information. They also go to church to get encouraged. But we also know, and based upon various reports, the vast majority of church attendance, roughly about more than half, are African American women. And so we know that in regards to African American women, play a strong leader or play a strong role within their family. So information, a lot of information is given out within the churches, so that information can be shared with family members. For example, we know that a presidential election is coming up, and politics plays a very important part, because politics develop policies. The policies affect health. So, for example, I went to church yesterday. There was an announcement saying, if you have not done so, please stay after church so that you can register to vote. So those are the things in which we're looking at, because you have a captive audience. You have an entity that is really focusing now on the spiritual being, but they also focus on the will or the natural or the healthiness of that being. So I just think it's a perfect mix. There's been a lot of interventions and studies in the African American community in regards to disease prevention and disease management. For example, there have been several studies that looked at management of diabetes, looking at stroke prevention, HIV/AIDS. Most recently, during the pandemic, we know that there was a lot of information shared about how to prevent the spread of disease, and also the promotion, particularly of the COVID vaccination. So again, in regards to African American, and I will share with this, African Americans are not monolithic. As I stated, there are various denominational beliefs. Not all African Americans are Christian. The African American church is not the only avenue to reach out to people who identify as African American, but it is an important vehicle.
Definitely important. Why do you think it is important as well to address the underrepresentation of minorities in the health science professions?
Well, as we look in the United States, we have health disparities. So we have health disparities not only for those who identify as Black or African American, but other racial groups or underrepresented minorities. And so I knew I was going to speak with you, and I said, well, let me get a little data so I can make sure I'm passionate about it. But I just want to share some data why I am passionate about and why others should be as well. So basically, African Americans account for 13.6% of the total US population based upon the 2020 census. However, and this is some information I got from the State of the US Healthcare Workforce from the National Center for Health Workforce Analysis, which was published in 2023. So again, African Americans account for 13.6% of the United States population. However, only 5% of active physicians identify as Black, 11.5% of RNs are Black, 4.1% of dentists are Black, 5.3% of physician assistants are Black, 6% of psychologists are Black, and 4.1% of physical therapists are Black. So if we look at that information, again, not trying to take resources from anyone else, but when 13.6% of the US population is African American, we do not have some of the key players in delivering healthcare to be within that number. And so therefore, we have to have individuals that are diverse to treat to treat their patients. We've learned, for example, there are different communications. For example, as I said, all African Americans are not monolithic. We have people who are coming from the continent of Africa. We have people who come from the Caribbean. We have nuances in English. We also have nuances in religion. And so therefore, we realize that if you identify patients, I'm sorry for saying you, but when patients identify with their provider, they're more likely to adhere to the information that is given. And so we are making some progress, but I think additional resources should be allocated, particularly improving and increasing the number of Blacks or African Americans in the health sciences. And this, I just want to end on this note. Believe it or not, there's only one historically Black college or university that has a school of public health. One. There are 4 HBCUs that have schools of medicine. Luckily, 2 more are being formed. Only 2 HBCUs have a school of dentistry. And if we look at taking an approach of One Health, looking not only at the health of our humans, but also the animals, there's only 1 HBCU that has a school of veterinary medicine. So if we're looking at ways to increase health and vitality and improve the health and wellness of Black Americans, we have to have more individuals who are going into those fields and have resources that they can be successful and also training them.
Thank you for sharing the data. Very important. Now, what projects, initiatives, or policies can we expect from the Black Caucus of Health Workers in this year's American Public Health Association's annual meeting in Minneapolis, Minnesota?
So, as briefly shared at the beginning of the interview, the Black Caucus of Health Workers, affectionately known as BCHW, is always looking for opportunities to collaborate and highlight ways to improve the health of not only Black Americans, but underrepresented and other individuals within the United States. One thing that we definitely have planned, and I call it one of our key sessions, which will happen on October 27th, which is a Sunday. At 4:30, we have a session called Racism, Colonialism, and White Supremacy, how it affects the health status of African Americans. And so sometimes we don't want to talk about that, but we have to be very mindful of how racism, colonialism, and white supremacy affects people of color. One thing that we definitely also have will be on Monday, the 28th in the morning, and everyone can see this in the master schedule. So, something may change, but we have something called the Dr. Paul B. Corneli Student Roundtable. And that gives an opportunity for our students who are at the master's level and at the PhD level to talk about their research table. And then also on the 29th, which is the Tuesday, we have our annual, again, Hildreth Poindexter Awards Gala. And so that's something in which we highlight key African Americans who've done great work in public health. One award will be very special this year. We started it last year, but this year we will offer it again. And it's the June Jackson Christmas Presidential Award. And that highlights individuals who've done great work within the field of public health. But one thing about Dr. June Jackson Christmas, she was the first Black president of the American Public Health Association, and she served in 1980, and she was also a founding member of the Black Caucus of Health Workers. So this year, we're very excited about coming to Minneapolis. We look forward to collaborating and engaging with our public health colleagues, but we also just want to make sure that we're putting forth things that can benefit those of the African diaspora.
An exciting program. Dr. George Smith Jr., we are grateful for your presence today and for sharing your knowledge and experiences. It was truly inspiring to learn about policies and issues involving the healthcare of African American community and the role of spirituality and religious belief in public health. We wish you much success in the upcoming APHA 2024 annual meeting and all your future endeavors. Thank you very much.
And thank you for the opportunity. And I hope to see you in person when we're in Minneapolis. Thank you so much.
Definitely. Thank you.